They fill our lives with unconditional love, playful moments, and joyful chaos. Our dogs and cats are more than pets, they're family. And just like any family member, their health is our priority. But there's a silent threat lurking, one that often goes unnoticed until it's too late: heart disease. Heart disease is one of the leading causes of illness and mortality in our companion animals. The goal of Red September is to turn the tide from reactive care to proactive prevention. Knowledge is our most powerful tool. Welcome to Red September, a campaign dedicated to raising awareness about heart disease prevention in dogs and cats. Let's understand the problem, the signs, and the solutions, all backed by veterinary science. First, let's distinguish between the two main types of heart problems. Heart disease refers to any structural or functional abnormality of the heart itself. Heart failure is a syndrome that occurs when heart disease becomes so severe that the heart can no longer pump blood effectively to meet the body's needs. The most common types differ between species. For dogs, the number one culprit is Myxomatous Mitral Valve Disease, MMVD. According to the Journal of Veterinary Cardiology, it accounts for approximately 75% of all canine heart disease. It's a degenerative condition where the valve between the left atrium and ventricle thickens and leaks. Large and giant breed dogs, like Dobermans and Great Danes, are predisposed to dilated cardiomyopathy, DCM, where the heart muscle becomes weak and thin, preventing it from contracting properly. For cats, the landscape is different. The most common condition is Hypertrophic Cardiomyopathy, HCM, where the walls of the heart, specifically the left ventricle, become abnormally thick. This stiffness prevents the heart from filling with blood properly. Studies suggest it may affect as many as 1 in 7 cats. The most insidious part of heart disease is its silence. In the early stages, there are often no obvious signs. The body compensates brilliantly, masking the problem. This is why regular vet checkups are critical. By the time symptoms appear, the disease is usually advanced. What are the signs to watch for? Coughing, especially at night or after resting. Difficulty breathing or increased respiratory rate. Reduced energy or lethargy. Fainting or collapsing. Dramatized carefully. Reduced appetite and weight loss. Swollen abdomen. A pot-bellied appearance. If you notice any of these signs, a veterinary visit is urgent. The cornerstone of early detection is the annual wellness exam. It's not just about vaccines. This simple listen with my stethoscope can detect a heart murmur or an arrhythmia, an irregular heartbeat, which are often the first clues. A murmur is the sound of turbulent blood flow, often caused by a leaky valve. Its loudness is graded on a scale of I to 6. But not all murmurs mean disease, and not all heart disease causes a murmur, especially in cats. What tests will your vet recommend? Stethoscope. Blood tests, ProBNP/NT-proBNP. This test measures a biomarker released by stressed heart muscle cells. It's a highly sensitive tool to distinguish cardiac from respiratory causes of coughing, as published in the Journal of Veterinary Internal Medicine. X-rays. Radiographs. These allow us to see the size and shape of the heart and look for fluid in the lungs, a sign of congestive heart failure. Ultrasound, echocardiogram. This is the gold standard. It provides a moving, detailed image of the heart's chambers, valves, and muscle function, allowing for a definitive diagnosis. While some factors like breed, age, and genetics can't be changed, we have powerful evidence-based strategies for prevention and management. Nutrition and weight management. Obesity is a major preventable risk factor. Excess weight forces the heart to work much harder. Keeping your pet at a lean, ideal body weight is one of the most important things you can do. For some specific conditions, like early-stage MVD in dogs, diets supplemented with omega-3 fatty acids, taurine, and antioxidants, as per the LEAP study, have shown clinical benefits. The parasite threat. Heartworm disease. This is 100% preventable. Mosquitoes transmit heartworm larvae. Once mature, these worms live in the heart and pulmonary arteries, causing severe damage and fatal complications. Year-round, FDA-approved preventive medication is non-negotiable, as stated by the American Heartworm Society. Dental health. This is a surprising one for many owners. Severe dental disease allows bacteria to enter the bloodstream and colonize on the heart valves, a condition called bacterial endocarditis. Regular dental cleanings and home care protect the heart. Breed-specific knowledge. If you have a predisposed breed, discuss a screening plan with your vet. This may include annual echocardiograms starting at a certain age. For pets diagnosed with heart disease, the future is brighter than ever. While there is no cure for most degenerative diseases, a multitude of proven medications can manage the condition, improve quality of life, and significantly extend survival time. Landmark studies like the EPIC study, published in the Journal of Veterinary Internal Medicine, proved that starting medication early, even before symptoms appear in certain cases of MMVD, can delay the onset of heart failure by an average of 15 months. Treatment is a partnership between you and your veterinarian. This Red September, let's make a pledge. Pledge to schedule that annual checkup. Pledge to ask your vet about your pet's heart. Pledge to be vigilant for the subtle signs. Because their hearts beat for us. Let's return the favor.